o'clock. I'm hoping that lots of people will be trickling in slowly. We've got at least 3 times as many audience members as panel members, which is always reassuring because we don't want to be talking to ourselves. People are smiling, so I assume you can hear me. It's lovely to see many of you on the call, old friends, colleagues, and lots of people I haven't met. My name's Dominique Allwood. I'm the Chief Medical Officer at UCL Partners, and I lead our work on climate and net zero, along with a few other colleagues on the call who've been contributing to that work. I'm really delighted to be here to chair this roundtable. There are 2 going on in parallel. So lucky you that have joined and are being chaired in this group. You've got me, and in another room is Pete with a bunch of different people. So hopefully you'll stick with us for the next sort of 40 to 45 minutes. We have a really packed agenda today, so I'm going to see if I can try and wrap up just a couple of minutes early to give people a little break before the next session starts at 1. But we've got some fantastic panelists on the call, a huge number of them, in fact 8. So we will be going through them shortly to hear a little bit about them, their work, their contribution to the net zero agenda, and then no real fixed plan for the session, one of those ones where it will just flow hopefully through the conversation. So I'll warm us up with a couple of questions, but really looking forward to hearing people contributing either in the chat or through raising their hand when the time comes and coming in on your mics and cameras. So hopefully it will feel like quite an informal and conversational session. It is being recorded for those colleagues who can't make it. Hopefully you will get a chance to catch up. So the topic in hand is a pretty big one, but it's about the NHS net zero challenges and priorities. And we've got a fantastic, diverse range of panelists who are all doing different things to contribute to that agenda, and I'm sure we'll have lots of views on what's important, what are the opportunities they see ahead, and some of the challenges. But before we get into the sort of topic and content questions, I'm going to ask each panelist to introduce themselves, just say a little bit about who they are, where they are working at the moment, and how their organisation, project or programme is sort of contributing to this space, and anything they want to flag that they would love to have questions on, so that it's a bit of a placeholder for those of you listening, just to say, yeah, I'm really happy to take questions on so-and-so, I'd love to get into a debate on so-and-so, and I'll try and keep a bit of a track on that. So not more than 2 minutes. I'm quite a strict timekeeper, but if you take less time, that's great. So I'm going to go down my running list and take people in order, and I hope they're all on. So if we find someone's not quite here yet, we'll skip to the next person. But the first person on my list is Peter May. So Peter, I hope you're on and you are able to come on camera. Do introduce yourself and your role in the Greener team. Hi, Peter.
Thanks, Dominique. Hi, I know lots of people on the call, so it's lovely to see lots of familiar faces. I'm Peter, clinician by background, got into the Green Agenda several years ago at a grassroots level, working in my local trust at Barts Health. Have slowly transitioned into the Greener NHS team and now work nationally full time. I currently look after the workforce part of our programme. So if you're looking at asking questions on the national workforce picture from a net zero perspective, I'm probably the person to ask on that front. But I've also done some work on our net zero innovation work stream, a little bit on our clinical transformation work, so looking at care pathways, decarbonisation, and now sort of transitioning into some work on estates and facilities and travel and transport. So I do have a level of broad knowledge across our programme. I think you're all pretty familiar with our work. We're here to support the system to reach net zero by 2040, and we have a wide variety of work streams on those fronts. So there's probably the key bits from me. Looking forward to hearing from the other panelists and learning a lot in today's session.
Wonderful, thanks Peter. And if you're happy, do pop your contact details in the chat out once you've introduced yourself so people can get in touch. Sounds like you cover a breadth of things, so we could almost have a one-man panel here, but thankfully we've got lots of people to help you out. So next on my list is Shazia, CSO of UMaker. Shazia, tell us a bit about UMaker and your role.
Yeah, sure. Thank you, Dominique. So yeah, I'm Shazia and I'm the CSO at UMaker, and it's an environmental company that builds science-based solutions to reduce the waste of medicines and the waste from medicines. So I spent about 15 years using a science approach to bring in innovation into the healthcare system, working at that juncture between academia, trusts and business. And at UMaker, we work in two ways. Firstly, we build solutions. So for example, early next year, we'll be releasing our medicines carbon footprint or MCF classifier, which is a suite of data and applications that will that generated and visualize product level medicines carbon information, so footprint information. Our method works at scale, and so we have a data set of about over 2,000 medicines products that we've estimated the carbon footprint for. And we developed MCF classifier through funding from the NHS and SBRI Healthcare Net Zero grant. And then secondly, UMaker also runs programs and initiatives. So last year we launched a not-for-profit collaboration called the Sustainable Medicines Partnership. And there are a few people on this call that are a part of that. And there's about 48 organisations that span across the medicine supply chain, from big pharma to ICSs to hospital trusts and everyone in between. And these organisations are working on a number of sustainable medicines projects, for example, in packaging and blister packaging and digital medicines information. So please Google UMaker or follow the SNP on LinkedIn if you want to find out a little bit more about us or ask me any questions over the next 45 minutes.
Wonderful. Thanks, Shazia. Lots of expertise there on medicines and waste. Please do pop your contact details, any LinkedIn or websites that you want people to have a look at in the chat, Shazia. Thank you. Next, I have got Addie from ABHI. Addie, do tell us what that acronym stands for those who may not know.
Thank you. It's a very long title, which is why we always go for the acronym, but it stands for the Association of British Health Tech Industries. So we're the trade body that represents health tech industry, and we classify health tech as medical devices, diagnostics and digital health. So it's a very broad spanning membership. There's about 420 companies now, I believe. And so that's everything from really interesting things to AI that's helping diagnose patients to MRI machines and everything in that field, essentially. And so I'm the sustainability executive. I joined about 1.5 years ago, and I was the first person in the role, so entirely new for the organisation as I joined. So very much working with our membership, making sure they know what sustainability is, what scope 1, 2, 3 is, what circularity is, working with them to make sure they know what to do for the NHS Net Zero roadmap. That is a lot of the work that I do. And then trying to work beyond that as well. So working with academia to where we can partnership to bridge the gap between academia and industry, and working with the NHS to see where we can work together there. And the many, many other stakeholders in the space, some of which I can also see on the call. So that's kind of the bulk of the work that I do with our membership.
Brilliant. Sounds like you're busy as employee number one in that sustainability executive role. Fantastic to have you with us. Do pop any links and contact details in the chat, Addie. Thank you. Okay, next we've got Alexis from Yorkshire Ambulance Service. Hi, Alexis. Do come in.
Afternoon, everyone. My apologies. I'm in the middle of the field, so if my signal drops out. We're planting an orchard today, part of the sustainability agenda. So my role, I'm the Environmental and Sustainability Manager with the Yorkshire Ambulance Service. And I've been, as a network around the UK, we are looking at what we can do to green the ambulance service and how we can play a role with the hospital system. And we're looking at everything that everybody's looking at in the hospital system, but also looking at Entonox, looking at what we could do to green our fleet. Each ambulance service has about between 1,000 and 1,300 vehicles. So we all have different roles to play with, looking at what we could get on infrastructure, working with the hospital system to get infrastructure at A&E and patient transport locations. But also we're looking at what we can do to green our services as a whole, and looking at our land, looking at biodiversity, pharmaceuticals, across the board. So we have a very broad spectrum of different things that we're looking at within the ambulance service, which is slightly different to the hospital system, but we all can work collaboratively on all these projects.
Fantastic, and a very well made point, given that we're in a overarching session that's entitled the Greener Hospital. So really important role of ambulances and the Ambulance Trust. And thank you for drawing attention to the breadth of what you're doing. And I think some of us have probably got envy. We're hoping we might all get involved in a bit of planting with you. So do consider us signing up at some point. You're on your phone, so probably a bit tricky to do that in the chat. But if you've got anything you want to send through in terms of your priorities or strategies, etc., do pop some links in. I'll try and do a bit of Googling as well. All right. Konrad, a friend and colleague of mine. Konrad, do introduce yourself. You've got two hats on, haven't you?
Sure. Thank you so much. Morning, everybody. No, afternoon, actually. Before I go in the boring title stuff and all that. So when I was, I must have been 10 or 11, and I'm from East Germany. So just after the wall came down, I joined a sort of an eco warrior group, which you would now call the extinct generation, extinct, or whatever they're called, so I've forgotten now. But we were actually really young, and we were knocking on doors, giving people leaflets, talking about the dying of the forests in East Germany and in Germany in general. So I was 10, 11. So this topic is extremely important to me, how to protect the environment, how to make things sustainable. Now to the boring bit. So I've got two hats on. First one is I'm National Director of the NHS Innovation Accelerator. That is a 3-year fellowship for solutions that need a bit support in their maturity journey to be adopted and scaled in NHS or are already there. So, and this year, what is really exciting, we've added a non-clinical theme to that, and that's probably why I'm here, and that's net zero and carbon. So we are wanting to attract solutions that are pure play net zero solutions also into our fellowship. And interestingly, we have already, a recruitment call is open since this week. It goes until the 22nd of October. I'll pop in the details in a little bit. But that is a crucial addition. We're working with Greener NHS, Nick Watts' team, as much as the AHSNs are doing, and a lot of people here as well. And the NIA has a collaboration agreement with that team to support our fellows in their carbon reduction plans and imparting learning on how to become true sustainable businesses. The second hat is working with Dom in the exec leadership team of UCL Partners. So my title there is Chief Enterprise Officer. I'm not commander of a spaceship. I'm looking after the industry engagement as well as the innovator engagement with our system. We introduced a discovery branch as well. Again, not the spaceship discovery, that works with biomedical research centers and universities, pulling through academic ideas, making them work, ready for solution testing and implementation. So it's a bit of a journey that we've done. Don't ask me how I do it. I've got 2 kids as well, but I've got an extremely versatile partner here, Tom, that's running her own business, but that's helping there as well. So there you go. I hardly sleep probably, but it's lovely to be here. Quick, my background, 6 years in pharma. I work for finance and in e-commerce and fashion retail, and now this gig. Nice to be here. Thank you.
Thanks, Konrad. I just hadn't clocked all these spaceship and space analogies in all your titles, but I can't unhear them now. And hopefully not generation extinction, the opposite, but fantastic to have you here. Do pop anything you want to put in about the NIA and the recent
Sure.
Link up with Green in the chat, etc. Absolute pleasure to have Fiona Adshead here, who does many things. She'll tell you a bit about the Sustainable Healthcare Coalition, but also working very closely with us as an advisor and has been a mentor of mine for a long time. So Fiona, over to you.
Thank you very much. And little known fact is one of my good NHS friends had family in East Germany. So not long after the wall came down, we actually visited Berlin, and it was a very exciting time. So Konrad, yeah, I can relate to that. So what does the Sustainable Healthcare Coalition do? Well, it is an organisation that was formed by the NHS, essentially in the recognition that it needed to work across the system with the private sector if it was going to solve some of particularly the measurement problems. And so we're a pre-competitive private public coalition. We've worked particularly on how you measure impact. So our first task was to look at how you measure the impact of medicines, but we've really gone on to do a lot of work on how you measure the impact of care pathways. So essentially what we did was break care pathways down into different activities, almost like Lego bricks. work out how you define them, attribute a carbon value, and then add them all up, and then that has your care pathway impact. We're currently working with colleagues in the Greener NHS team to update the guidance that we worked on together and the calculator that we've got, and we're applying the same approach to research. So we're looking at the moment at developing a standardized framework for how you measure clinical trials and impact their research actually in general, because it's very similar really to a glorified care pathway. And we do lots of advice and connection into a number of initiatives, bringing together industry with clinical colleagues in particular. So that's me in a nutshell.
Wonderful. Thanks so much, Fiona. I'm sure you've probably got a whole Wikipedia set of links to put in that chat, but do pick a few choice select ones. Great to have you here. We're almost through. We've got two more people to introduce. Pleasure to have Neil Cartwright from NHS England with us. Neil, over to you.
Hi, good to be here. So I'm Neil Cartwright. I work in one of the regional teams. So Peter works for National Greener NHS. Then we have 7 regions, and I work for the North Eastern Yorkshire region. So that incorporates 4 ICBs, which is Humber North York, South Yorkshire, West Yorkshire, and North East and North Cumbria. We, as a team, are tiny and cover a large geographical area. We tend to link in with under-resourced, overwhelmed sustainability leads, whose desks we tend to throw everything at. My particular areas are around estates and facilities and adaptation, and I take a lead for communications in the North Eastern Yorkshire region as well. Yeah, that's me.
Lovely to have you, Neil. I'm sure there's people on the call who are thinking they need someone just like you to support them in their busy roles when they're also getting lots of things chucked to them. So thank you. Do pop your any details you want to share in. And last by no means least is Claire Igoe. Claire from Manchester University Foundation Trust. Claire, do come in and say hi.
Yeah, thank you, Dominique. So I also wear 2 hats. So I'm the Group Associate Director of Sustainability at MFT, which is a very large acute teaching hospitals. There's 10 hospitals altogether as part of the group. So I'm the strategic lead for sustainability and waste management, and my role is really around working on our strategic, so it's overall accountability for the Green Plan, but it's really on those more strategic aspects of delivery, engaging with senior leaders, and particularly with the priorities that our Climate Emergency Response Board has set out. My other part of my role at the moment is that for the last 14 months, I've been on a part-time secondment with NHS Greater Manchester Integrated Care as the interim net zero programme director, which is interesting, from working in a population health function and putting in a brand new programme in place there around a green plan. And that is very much around what are the things, how can we collaborate with each other, and so working with system partners like the combined authority and focusing on those things that we can do once across the whole of the system, rather than the typical things that you'd expect an organisation to be doing. So I think I'm very lucky because I get to work across a really broad agenda, but I wouldn't necessarily consider myself a specialist in any of those areas. Thanks.
Wonderful. Thanks, Claire. Busy juggling hats. I don't think I've met more people in one panel who've got so many split personalities on here. So someone's already asking Claire, how do I connect? So I'm sure there's many people who have got roles both in providers and ICSs that want to connect with you, Claire, so do pop your details in the chat. I always think it's nice to spend a bit of time getting to know the panel, because they bring such a wealth and we've got such a great set of expertise that I know we could have an amazing conversation for about 4 or 5 hours, but we have about half an hour. We already have one question in the chat, which I'll come to shortly, but if anyone's got things that they want to ask, do start putting your hand up, start putting things in the chat. If you've got one you want to aim it at somebody specific, do let us know as well. If it's just a general question, that's fine too. But before we come to the first question that's in the chat, I guess the title of this session is about challenges and priorities, and I might just come back to you, Claire, because you caught my mind in thinking about the type of role you're playing at the moment. Obviously we understand, all the people I guess who are on these calls and part of this conversation today understand the importance and the imperative of doing this work, but you can't stray for a moment without looking at all the pressure that the NHS is currently under at the moment. Let's have a little think about both the challenge and the opportunity for people who are trying to embark on this from a bit more of a sort of strategic and leadership perspective, but also from their kind of day jobs. Claire, tell us a bit about what you're facing there and how are you sort of navigating some of that, and I'll bring some of the other panel in at the moment as well.
Yeah, happy to do that. So I mean, again with both of my roles, really, I'd say what I'm hearing at the moment is, I think it's the noise about it's the pressure that the NHS is under right now in terms of like waiting lists, and also the financial. I think that financial pressure is kind of getting louder and louder. So I do think that there's probably some agility that we need as sustainability professionals, and taking that approach of, this is what you need from us right now. So I think we need to prioritise those things where we are saving both money and carbon at the same time, because we've just got incredible challenges around capital right now. And I think that would be that would probably be the biggest area for me. And then I think the sort of workforce, getting capacity from the workforce to understand and be involved in this, because as a sustainability leader, you are not just sat there. You should not ever be sat there on your own. You should be working through others. You should be working through, I mean, the best things I've seen have probably come from the clinical leadership. That's where the big innovation is taking place, and it's because people have stood up and said, I can see a problem here, and I'm happy to put myself forward to go and fix that. As soon as you start sending off, oh, I've got a great suggestion, we could do this, send it to the sustainability team, it'll go nowhere, because as one of the panelists raised before, we've got some incredibly pressured people within organisations. So I think that's where we need to be doing more collaboratively together. I do see a lot of duplication, Dominique, so it'd be interesting if we could talk about addressing that, because I think that meets both areas of the net zero challenge, but also addressing that sort of productivity and financial challenge as well, if we can take some of that out of the system. So I'll stop there because we've got lots of panelists and I don't want to dominate the time.
Wonderful, but it's like dominoes, and I think we're going to be like throwing hot potatoes. I might make you all say who you're going to pass the baton to. Great points, Claire. And on the point of duplication, I think so important. I mean, we're talking about waste in all sorts of areas with a sustainability lens, but also wasted effort when we could be learning and sharing and not reinventing the wheel. So I might just bring a couple of people in on that. One of them is I guess between Neil and Peter, working slightly more in a region and systems level, you probably see some more of that stuff. What are you doing to help try and connect people up, and how can people get more connected and stop the duplication?
Good question. One of the benefits I think that we've got as regional teams is we do come together as regions and we do communicate between regions as well. So when there are an example I would give is Imperial College hospitals have implemented automated power down for their PCs. It sounds like a no-brainer, but a lot of trusts aren't doing it. For a lot of reasons. It's for what we've just said there around the urgent pushing out the important. There's always something else to be getting on with. So with that, what we're doing is just bringing Darshan, who's their sustainability lead, and Mushtaq, who's their technical lead, into a webinar, sharing that with our sustainability colleagues, who are then pushing that on into their IT colleagues and sharing it with their finance colleagues as well, because Imperial have made, I think, £440,000 worth of savings. Speaking to your point, Claire, about justifying the work that we do with financial savings, not just carbon dioxide that no one understands, but financial savings, is how do we surface that work so that we can de-risk it? Because one of the things when you automate the shutdown of a PC is, oh my life, I mean, it's macabre, but what if we damage some, what if we cause harm by running that? Well, Imperial have done the work. They've done the difficult stuff. They've worked out how to do it. They've made some mistakes and they're keen to share them with us, but we should be propagating this learning across the system, and it could save absolute millions. And the benefit to Imperial as well is, from the offset of that project, they made an agreement that they would reinvest a proportion of those savings back into IT. So there was a stimulus there for the IT department to get on board with it. I think my argument for sustainability colleagues is if we are going to do work that does demonstrate a cost saving or has the potential to demonstrate a cost saving, and they will, is how do we, at the inception of those projects, ring fence some of that money for reinvestment into further sustainability projects. So there's a challenge back to colleagues as well, to have that thinking at the start of a project.
Great, thanks, Neil. Really thoughtful points. And I should have mentioned, I kept that bit quiet, but I also wear two hats. I work at Imperial, work very closely with the Green Team, of which I'm very proud of that work. So thank you for flagging. I might just bring Peter in then on 2 points, really. Peter, just this point about the duplication and the case study sharing. I know that Imperial case study has actually been written up, and I think it's probably on the NHS Green Team website. So maybe worth you touching on where people can find some of these case studies and what the role of the Green Team is in surfacing some of this best practice and sharing.
Yeah, thanks, Dominique. There's a lot I could cover here. I think we obviously, as a national team, do play a critical role in scale, adoption, spread, sharing of all the successes that are happening out in the system, and also the challenges, of which there are many. I think what's really exciting for us to see as a national team is that what's happening in the system is often outstripping what we're able to keep abreast of and what we're able to share. But if you are interested in seeing some of the things that we have put out there, there's a bank of case studies and examples on the Greener NHS website. And if you're someone who works in the NHS or has an NHS email, you can access a further bank on the Future NHS space. I think each region also has their own Future NHS space as well, so there'll be different stuff on those. But yeah, do have an explore, poke around that resource. And I think generally on sort of sharing, there's, as I said, there's so many different areas that I could touch on. I think one is driving that clinical leadership that Claire mentioned earlier. I think that is so critical. You know, it's the vast majority of our NHS workforce, and we are seeing some really exciting developments there. So I think you'll probably see that we've done quite a bit of work with the Royal Colleges, because contrary to perhaps popular belief in this room, perhaps, is clinicians don't really listen that much to NHS England and what we've got to say. We're not where people go as a first port of call as a clinician. They go to their specialist areas, and absolutely rightly so as well. So we're working with those partners to make sure that we're putting the right stuff out there, but through the people who actually have a proper link and affinity to those groups. Having said that, we have done a little bit of work on networks, and there's a national nursing and midwifery network that's recently launched under the banner of NHS England. So there are bits where we have sort of taken that responsibility on ourselves, but I do think a lot of our work nationally, as you would imagine, is working with those partners who have the best links into those groups. You're muted, sorry.
Gosh, you'd think I'd learnt this by now. Thanks, Peter. If you've got any links you want to share to anything, do pop that in the chat as we're talking. I'll give you one quick follow-up question that's come into the chat, which I hear a lot, which is, are there some ranked priorities around net zero? Has the NHS Green Team got something like that? Where should people be starting if they're thinking about where's going to have the biggest impact?
That's a really good question. I think it would be, or Neil might have something to add here. I don't think it'd be fair to truly rank things, because there's different priorities that people can do at different levels of the system, and there are low-hanging fruit that should be done first, even if they're not the highest impact area. So there's lots of different ways that you could rank the actions. I think a place to go, though, for guidance on where high impact is obviously the Delivering a Net Zero report, which sort of sets out the carbon footprint of the NHS and where the biggest areas are, and some of those won't be a surprise to people. You know, our supply chain is about 62% of the emissions in the NHS, and then there's big chunks for estates and facilities, travel and transport, medicines as well are kind of the biggest from a carbon perspective. But as I said, there's so many other areas that you could argue could be top of that list. You know, we're not going to get anywhere if we don't engage all 1.4 million staff. So you could say, well, actually, that's number one. We need to upskill people there. So there's almost endless opportunities, because although we've made huge progress on this journey, there's a long way to go as well. So I think Yeah, no specific ranking. The only place I could say, if perhaps as an individual or a system level leader, if you wanted just a bit of guidance and a steer on where to go first, there are some specific sections on the website around taking action as an individual, organisation, system. So do check that out on Greener AHS. I feel like I've mentioned several of our resources already a few times, so I'll share some links in the chat whilst others are answering questions.
Wonderful.
Just
Go
as
on,
Peter
Neil.
was answering that,
Yeah.
well, it's like we speak as a hive mind at Greener NHS. So just as Peter was doing that, I was rattling about for the link to delivering a net zero NHS. That for me is that it's 76 pages. There's lots of pictures. It's not a dull read, I don't think, but I would say that, wouldn't I? And it does break down exactly where our emissions are. So I very much would recommend that. And in terms of priority, one of the challenges that we've got is when everything's a priority, nothing gets done. So what I would suggest is that work with the willing. If there's a piece of work, then drill down and focus on those pieces of work and don't try and do everything. And what Claire was saying there as well, which is sustainability leads within trusts are seen as being the answer for everything, and it's incumbent on them to make those links in with other departments to find that support out there, because they don't have authority. Typically they don't have authority power within an organization, so it's how they create those relationships to be able to do that, and that can be quite challenging.
Great, thanks so much, Konrad. I see you've got your hand up, so I'll bring you and Fiona in on a moment on another question that's come up, but thanks, Chris, for that question. Shazia, perfectly teed up by the gang there on medicines and other bits. Why don't you tell us just briefly a little bit about a couple of the challenges, opportunities, how people might interface in some of the work you're doing?
Yeah, I think I would like to kind of focus on the opportunities really, because let's kind of a step going forward and tie it a little bit together about where are the priorities and how we can get over them. So medicines is a priority because it's, as Peter said, 25% of the NHS's emissions are from medicines, and 5% of those are gases and inhalers, and the other 20% of all the other medicines. And all those others have not been really touched upon yet, other than from a cost perspective, which we won't stop spending, so therefore we can't save on carbon if we do it that way. But there are many data sets out there, and I think this is one of the important parts, that if there is good evidence and there's good data sets out there, then that's something that people can leverage, where they can then see that there's an impactful change. And an example of that is that, say, for example, there is already an agenda to reduce the antibiotics prescriptions by 20%, unnecessarily done so. And there are consequences of that when people are prescribed antibiotics and antimicrobial resistance. But there is also a cost saving there. If you decrease the 20%, then you decrease 20% of the cost of that medicine. But then there is also the carbon saving on top of that. So then you've got that triple win. So when it comes to that kind of utilizing those data sets and then actually having something that you can measurably impact from those 3 points of view, I think they're a good place to begin, because then you've got that pilot in of something that actually really is working, it's making an impact on every area that you kind of need to make an impact on. And I think once people then start absorbing that you can make those changes and they can see those changes, then there's a knock-on effect of where else one can go. But I think the priority of medicines is trying to find those triple wins, essentially. And then I think benchmarking is really important as well. Everyone spends a lot of time having to submit data on things, how much they prescribe, what's the cost of it, etc. So if we can leverage that data and then prioritize things that way, I think it would be a really good thing forward. And then you can see, for example, you can compare regions. This region is doing really well, we're taking inhalers, and then this region isn't so much so. Okay, they've made this much savings in their carbon, well, why can't we do the same? Then they could approach that region and say, well, how are you doing it? How did you make it work? So somebody's already done the piloting for you, and then you can go, well, look, hey guys, we can do this because they've done it there. So they are the example. There's lots of those kind of pilots that are going on. So people don't need to do those pilots themselves. So I think that's where we should start, really. And then we get that enthusiasm and a motivation that we can make a change to continue that transition.
Wonderful. Thanks, Shazia. Really helpful tips. I think quite practical things there. So I'm going to be rattling through some more questions. Great one from James. Hi, James. Thanks for joining. How do we bridge the gap between sustainable innovation and trialing this in the NHS? So I'm going to go to Konrad because it's a perfect tee up for you. And you also had your hand up, Konrad.
And I put my hand up for that one. So I'm gonna venture a little bit. So BlackRock, which was one of the world's largest fund providers and venture funds, they have dumped a huge amount of sort of high carbon emitting industries and focusing more on sustainability. Why? Because there's money in it, and I think that's a good lens. Okay, let's just be real. We're not going to save the planet by waving green flags and singing Kumbaya. What we're going to do is we're going to offer financially sustainable ways for ICSs and trusts likewise to enter the sustainability journey. And that works through, for example, savings or predictability of spend on energy over 5 years or 10 years on, say, cloud services or on-premise cloud services or whatever that is. That's a huge problem. I sat down with trust leaders a few weeks ago about something else and just came up. A huge worry is the cloud pieces that ICSs or trusts at the time were sort of advised to enter with the Microsofts of this world, and the costs are spiraling out of control. So, and also the energy usage is spiraling out of control because more and more imagery is being stored on these clouds. The files are getting larger, right? We're not floppy disk anymore. We're now 5 times a DVD, basically. And that is a problem. So, and this is me working with a lot of scale-up startups, and more so now, hopefully through the NIA in this space. If you can offer just a sustainable, financially sustainable way of the NHS, quote unquote, working with you over years and years, and your costs are predictable that you're bringing to the table and are predictable for the NHS, that's a winner, because the heart is where the money is ultimately. And if we can crack that, we crack a lot of the sustainability challenges. Education, I agree, huge piece, but the money question needs to be addressed. How can you test and pilot in the NHS? Well, that's the question where, again, providing a proper business case and already at pilot stage, being able to say, look, this is what we can deliver to you. This is the exit plan if this thing doesn't work, or if you have to keep paying because we run out of an SBRI grant, which only lasts 2 years, or a pharma collaboration, which lasts 2 years. But this is how you, ICS, can keep paying for that. So we're just going to have to be a bit real. And if we're thinking commercially about this, like BlackRock does, then we are up for winner.
Thank you, Konrad. Fiona, I'm going to bring you in. You talked about some of the work that you've been doing, looking at pathways end to end, which I'm sure is starting to inform a lot of work on ROI and business cases, etc. So I'm keen to just think about both from your experience of how do we bridge the gap between working with industry, innovators and researchers through some of the work you've been involved in, both with UCLP and wider, and also how people are starting to use some of these methodologies, tools, etc. to understand and make the business case for this work.
Sure. Well, I mean, I think that there are a number of different elements to it. It's how do we set the system rules? How do we connect? And then how do we standardize? So I think it's those 3 things. I mean, I think if you think about BlackRock and Larry Fink, I mean, a lot of what they've done with colleagues in the finance sector is actually set a number of accounting rules for sustainability. So they've standardized. And I think, you know, that's really driven the sector, because if you can't assess the capital investment, you can't know whether your return on investment is going to be there. And so I think the kind of work we're doing at the moment on how do you get a standardized approach for measuring care pathways, and we all use it and we all improve it has to be a critical way forward, because we don't need to reinvent how you measure things all the time. It's just a waste of time. And I think really working with what the NHS does is really, you know, is going to be really important. I think the point about connecting up it is really important, because I think, you know, what I've seen in the system is that we don't invest in bringing people together to work, and that is what makes the difference. Because in my experience of managing change, it is about the system connectors, and then people realize that they can realign resources. So, you know, a good example of that would be, you know, the work we've done with Newcastle on looking in depth at the impact of renal hemodialysis. We did a life cycle assessment there. We then set up, well, Surin, who led the work, a consultant there, set up the National Sustainability Committee. We've now produced an international calculator to make it very easy for people. We're now looking at developing an international community of practice. We've just got to make it easy for people to act. And I think, you know, our own work together, Dominique, on Connecting for Change, the Sandpit and Innovation approach, where we brought together colleagues in the NHS with academics to really bring that technical understanding. I was amazed, having facilitated that process, just how, well, I wasn't amazed, but I mean, the system is so unconnected. And unless we bring people together, you know, we have to invest in that. So I think that's critical. Is the return on investment? Absolutely, because so much of sustainability is about reducing waste and efficiency, and it's about a mindset about there is an opportunity for us to make it work better. And is this just about, you know, nice ideas? No, it's not. The work we're doing on clinical trials, Novartis was presenting earlier in the week, and the work they've done on their clinical trials portfolio, by applying approaches of actually measuring where they're using waste, they've saved £21 million in their clinical trials portfolio. That's huge. It's over a third of the cost. And a lot of that is about thinking smarter around how you deliver things. But it's about having a standardized approach where we can work together. So there is a lot that we can do. And I also think, as Konrad was saying, we need to learn from other sectors as well, because, you know, a lot of what they're doing is smart. And I think in terms of priorities, I don't actually think it matters where we start. As long as you've got the system rules, we can well support a number of different innovations across the system. The issue is connecting it up, and the issue is learning from that, and then really thinking about how we make the connections to change the system rules, but then really support grassroots innovation. Because I agree entirely with Claire about, for me, you know, when I worked at the centre, we didn't know really what was going on. I mean, not really. All the ideas for innovation came from people who were working in the services, and that's what we need to listen to as leaders, I think, in the system.
Fantastic, wise words as ever, Fiona. I'm keen to bring Shazia in. Shazia, there's a question around the balance between the tech and the
Oh, I think that's Dom gone. That's okay. I think Dom just popped off. I can second. That's fine. Right, Shazia, we had the question was, do you want to pick it up?
I'm trying to find it.
Let's have a little look.
I know.
Dominique is back. You're on mute, Dominique, now.
I'm
just
so
wanted to pick it
sorry.
up. There we go.
I had a bit of a drop off there. I'm keen to bring a couple more people in. I realise I've already been to Shazia, so let me bring Alexis in. I'm keen to sort of understand the balance between, one of the questions we had was the balance between things that are in direct control versus working with the supply chain. And Alexis, I'm sure you've been doing things across both of those domains. So let us know a little bit about how do we balance attention, and then I'll come back to the other panelists in a moment. I'm not sure if anyone else can hear Alexis. Has she also gone? No, can't hear. Okay, Addie, why don't we come to you about the balance between finding the tech innovations and solutions versus the energy and attention spread and adoption conundrum. And I'm sure you've got some views from the position that you sort of occupy.
Yeah, so it's a slightly different viewpoint, obviously, because we're industry side. So I think it's a universal challenge of trying to get these innovations into the NHS, and no one person is going to fix that. I think that highlighting them, and it's a really difficult area to do. Industry is working very hard at these innovations to get them through, and there's been a number that have come through the SBRI funding and all that sort of thing. And I think it's ensuring that there are the mechanisms in place within the NHS to actually adopt them. And we know that there are some companies that are trying to sell devices that have meant that it moves a patient from needing to stay overnight for a procedure to then moving to a day case, but perhaps they might be in a different department, which means that department didn't buy it before, which means that that's an added cost to them, even though it's an overall saving. So I think it's really difficult. I think raising that higher up within the NHS and creating those mechanisms is very important. And happy to assist where possible, but I know that it's a difficult area. Can I just come in on the engaging with suppliers one as well, on how to do their scope 3? Yeah. Just in answer to that question, I know that many of you on the call will be aware, but the net zero roadmap is something that all suppliers have to abide to. So if you're wanting to keep contracting and selling with the NHS, then you have to follow that. So all suppliers for the last year and a half, about since when I joined really, and now answering social value related questions as a part of every contract with the NHS. And even though it's only meant to be for contracts over £5 million per year, the introduction of carbon reduction plans earlier in the year, if you have a framework with the NHS this year, because of the way this panned out following the government PPN, I would say it's nearing on the majority of suppliers to the NHS now are completing the carbon reduction plan. So industry is already doing that in a way. That was me very much taking up for industry, but it is a requirement now, and they're doing it, and it has been a interesting journey, but also the introduction of carbon reduction plans. The feedback that we've got from our members is that the implementation of that has meant that they've been able to raise sustainability up to the C-suite within their organisations, because everyone has to be involved in the process. So it seems to be not just the people that are very interested in it or the sustainability leads in their organisations doing all the work. It really is going throughout the entire business now.
Wonderful, thanks Addie. Lots of nods around there. Thank you for picking up that additional question. Neil, did you want to come in back on maybe that or a different point?
It's just on procurement, and I'm not a procurement expert. I do think it's PPN 0620 that we're talking about around social value. The really interesting thing, and we're doing a little bit of work up in northeastern Yorkshire, is how do we utilise that social value element to affect a change to health and well-being at place? How do we work with public health colleagues at place to understand their local health challenges so that we can affect through our supply chain those wider determinants of health? That's quite exciting. It's quite interesting work to do. And then how do we replicate that across the country? How do we get that right? So yeah, I think the next iteration of this is really, how do you get procurement teams to link in with public health in terms of that understanding of that wider joint strategic needs assessment, the JSNA stuff, around the public health intelligence, so that we can use that as a lever to bring our procurement might to bear on local health improvement. Go figure that one out.
Well, listen, I'm a public health consultant, and I know a couple of others on this call have definitely got expertise in that area, but we could have a whole new session on that. And I'm aware that I said that I would try and get us off a couple of minutes early, and I'm a very strict chair about these things, because I think it's important people have breaks and we stick to time boundaries. So I will make a suggestion to Pete that we need to do another session on thinking about the angle of population health and public health. It did come up, I think, in the comments in one of the earlier sessions. There's been some really active people in the chat that I want to thank that I haven't had a chance to bring on camera. Nigel's been very active, and it looks like Nigel's got a session coming up shortly. We've had Chris on, we've had James on, and we've had almost 70 people all together in the room, including our panelists. So really great engagement. It feels like we are just scratching the surface. So I'm really sorry that we aren't going to get a chance to do much more on this, but thank you so much for all those who have joined. The chat is very rich. There's lots of people who are already having sideline conversations, which is fantastic. So do check it out, because I couldn't do justice to it all. There's some really rich links and resources, and people have been very generous with their contact details. So I'd really encourage you to don't think of this as a one-off thing, to make sure that you really take some things out of this and try and continue those conversations and contact connections. But we haven't had a chance to hear from Alexis. I think she's probably busy still planting, so good luck to her. But thank you so much to the rest of all of my panel, and wonderful contributions, thoughtful and thought-provoking. Thank you very much. Have a good rest of your day, and I hope you see many of you at 1 in the next session.